All right, so unfortunately our panel is having a bit of a link issue. We're getting it resolved pretty quickly. So if we can just kind of pause for a couple more minutes, I apologize for the inconvenience. All right, so we've been able to have our attendants come in. So we're just going to kind of start off. Thank you for coming to Iowa State's first Free Health Conference. We're super excited to have you all. Just kind of a short agenda for our session today. We're going to start off with some brief introductions from our panelists about who they are and what they do in pharmacy. And then we'll move on to some previously collected student questions and then open up for questions from students. So we can just kind of start introductions with our panelists, the order that they came in. So we can start with Dr. Dali and then go to Dr. Gandhi and so forth. So I'm gonna mute myself and let you guys start talking.
Well, good morning. My name is Mike Daly, and I'm an associate professor of pharmacy practice at Drake University, and I teach pharmacy informatics. I have a practice site at the Iowa Clinic, which is in West Des Moines, and my work is a combination of informatics and population health management. I'm a data nerd, and so the role that I have makes me very happy. I'm working with a lot of data. I take students on rotation at the Iowa Clinic, and we work on various data-driven projects related to either trying to decrease medication-related costs of care or look at medication-related quality metrics. And then I also teach some classes down at Drake University, usually again related to those topics. And it is a pleasure to be with you this morning.
Hi, everyone. Good morning. My name is Dr. Gandhi. I actually received my PharmD from Chicago State University College of Pharmacy here in Chicago, Illinois. I worked in the community setting for about 3.5 years, and I really, enjoyed the counseling, mentoring aspect of it. And a new position opened up at my university, actually, in recruitment and admissions. So I've taken on the new role. I'm really excited about it. It's been going well thus far. And I also facilitate for some of our practice labs there. So it's a great way for me to interact with students and just, provide them with real life experiences and counsel and mentor them. So I've been doing that since, I believe, November.
All right, good morning, everyone. Thanks for joining us. Thanks for having us too. I know it's probably a little early on a Saturday morning. At least it's 11 o'clock in my time zone. I know it's early for you. My name is Dr. Abdur Rasul. Dr. A is fine. I work at Northeast Ohio Medical University. We are located about an hour southeast of Cleveland, kind of near Akron, those of you who are familiar with Ohio. And so I'm an assistant professor there. I'm also the director of pipeline programs. So I do a lot of programming with high school students and undergraduate college students to try to get them interested in a career in pharmacy. I'm also a graduate of Northeast Ohio Medical University. I graduated there in 2014. So I'm familiar with the program and I know what it takes to succeed in our program as well. And I am also a community pharmacist as well. So one day a week, we have a pharmacy on campus that I work at one day a week as a community pharmacist as well.
That's awesome. I love how everyone kind of seems to have different experiences within pharmacy careers. That's great. All right, so just a reminder for students, if you have questions, feel free to put them in the Q&A chat box. We'll make sure to answer any that are put in. But yeah, we kind of have already hit on how you all have kind of gotten to your positions. Let's kind of start off on a positive note. So what's something that you really love about pharmacy that you found either in the profession or you kind of noticed about the profession that caused you to go towards it? Yeah.
Shall we go in the same order or does it matter?
Sure, if you guys want to. If you don't want to answer every question, that is totally okay. Yeah, we can just kind of speak up whenever you'd like to.
I'm happy to lead off and then whoever wants to take it from there. But one of the things that I love about the profession of pharmacy is that there's a lot of different ways to impact patient care. And sometimes that's very direct. I'd say one of the things that's really been exciting for pharmacy here just recently, despite the challenges that the COVID-19 pandemic has hit in so many different ways, pharmacists have really had a chance to recently shine in a way with the vaccination rollout. I'd say that's been a really positive impact for the profession. Students are getting involved. I know Drake students and I know students at other universities have been getting trained up and getting these opportunities to directly impact care. But then there's more traditional pharmacy roles, not only at retail and community, but also in hospitals and things like that. And I just think that with pharmacy, there's just a lot of diversity in terms of the opportunities to impact care. And my role is definitely less direct and more behind the scenes, but looking at data, looking for opportunities. So I think if you're looking for a profession where you can explore lots of different avenues, sometimes even within the course of the same career, I think pharmacy could be a great profession for you.
I have to actually agree with Mike or Dr. Daly. I think that, one of the best parts about pharmacy is just the diversity, just the different avenues that you can take with your PharmD degree. For example, I've taken on a very non-traditional role as a pharmacist, but, it still builds on the aspect of functioning as a mentor, as a counselor. Many times, I think even in the community setting and hospital settings, one of our primary roles is to be, have adequate counseling skills and, and all of that. So this is more at a beginner's level in terms of really setting up our students for success, having somebody that they can relate to that's been out there so they learn from your experiences and whatnot. So I was one of the very few lucky ones that did get to participate in the, COVID-19 vaccination rollout. So, that alone is another great role that you can have as a pharmacist. So you can pretty much your PharmD degree is what you make of it. You can build upon it, do whatever you find you're passionate about. So I think the diversity in careers that you can have in pharmacy is, I guess, one of my favorite aspects of pharmacy.
Yeah, and I would definitely have to agree with both of them. There's a lot of things that I love about pharmacy, but for sure, there's so many different avenues you could take with just one degree, right? So you don't have to go back and get another degree. I went to pharmacy school thinking I was going to be a community pharmacist for the rest of my life, and it turns out I fell in love with academia, and so here I am teaching, right? So I never thought I'd be going to pharmacy school to become a professor, and yet here I am. And so there's plenty of other avenues that you could take as well. At NeoMed, most of our faculty are what we consider shared faculty. So we have psychiatric pharmacists, pediatric pharmacists, infectious disease, ambulatory care, The list goes on and on and on. So there's so many different specialties that you could get into with just one degree. The other thing that I really love about pharmacy is kind of the direction where the profession is headed. And so we're seeing so many more jobs open up in health systems and hospitals and in the ambulatory care setting because they're starting to realize that pharmacists are worth the investment and that pharmacists can save them money, right? So, a lot of hospitals are realizing, hey, if I pay a pharmacist, $125,000, $130,000 a year, they could save me $500,000, $1 million each year. So that is definitely worth the investment, right? They're going to prevent our patients from getting readmitted to the hospital. They're going to save us a lot of money on medications. And so I'm excited about where the profession is headed, that people are starting to realize the value of a pharmacist. And so I think we're going to start to see a lot more opportunities for pharmacists open up. So, the days of thinking that pharmacists stand behind the counter and count pills all day, those are long gone. And so we're moving on from that.
Those are some great kind of descriptions of your careers and how you've kind of fallen in love with pharmacy. Kind of going off of this, how do you guys balance your day-to-day lives? So many of you kind of are involved in academia and teaching and also community pharmacy. What is like your daily week, or how do you balance your career with your life?
I'd be happy to let Dr. A or Dr. Gandhi start out. So I don't know, get to talk first.
Sure. When I was in the community setting, I think one of the good things about like when you take on a traditional role is that you really do leave work at work. So, you're never carrying anything home. So once, you work in the hospital setting, in the community setting, when you leave, you really do leave. So at that point, you have your time to enjoy with your family, you have time to enjoy, taking on any hobbies that you like and stuff like that. Sorry. For example, I love to bake. So anytime I get off, I'm baking and, just trying out new recipes and stuff like that. And then with this new role, I'm primarily working from home. So part of my week is spent with recruitment and admissions and hosting events for new students and mentoring. And then the other half is spent going to clinics. We're primarily going to long-term care clinics and, immunizing the residents there. But after that, it's really just understanding what a work-life balance is for you. And I'm a very big advocate for it. I think that you need to be able to give yourself plenty of time to enjoy, what you like to do, because there will be a very quick burnout. So at the same time, it's really important to allow yourself a break, do fun things. I really like to work out as well. So I'm big on fitness. So I will always make time to work out. And then on the, flip side, I love baking. So I'm always eating. So it goes hand in hand. But yeah, that's pretty much what I do, allow myself to have that, I guess the fun time. Allow myself to not bring work home and, relax as much as I can.
Yeah, and I would kind of go off of that. So, you asked about, work-life balance. It's busy, that's for sure. It's very busy. And so I used to work full-time in community pharmacy. And like Dr. Gandhi said, the great thing about community pharmacy is you leave work at work. You usually don't take work home with you. So you leave work at work and home is home. So there's a clear separation between the two. When I got into academia, that was no longer the case. Usually I'm bringing work home with me. I'm also working from home. So it's more of a gray area there and rather than a clear separation. But the thing at least with what I do, is I absolutely love what I do. And so I don't necessarily feel like I'm working. So you probably heard the phrase, if you love what you do, you never have to work a day in your life. And that's exactly what I'm going through. So I feel like I'm not really working, even though I actually am working, just because I absolutely love what I do. But, as well, like we talked about all the different careers in pharmacy, that allows for appropriate work-life balance for where you are in your personal life. So for example, when I graduated pharmacy school, young single guy, I could work those long shifts, right? I worked at Rite Aid, and I could work those 12-hour shifts. I could work, 3-4 days a week, 12-hour shifts, and have 3 or 4 days a week off. And that was great, as a single person. Later on in life, maybe you get married, you settle down, you have kids, and you need more of that 7 to 3, 8 to 4 sort of thing. You could always pivot, and go into another area of pharmacy again without having to go back and get another degree. So that's the great thing, is it's very flexible, right? So you could pivot to another area of pharmacy where it allows for a better work-life balance for where you are in your personal life.
And I'll echo a lot of what Dr. Gandhi and Dr. A mentioned. Earlier in my career, I had a job as a clinical pharmacist in the hospital, and I would say my days were longer. I didn't necessarily take work home with me, but the days could get kind of long, following up on issues from rounds in the morning and things like that. One of the things that attracted me back into academia, like Dr. A said, was that flexibility. Is now I have a little bit more flexibility. Being in academia, though, there is work to take home, and the work will often flow with where we are in the semester. If I'm teaching a class, it's just going to be a little busier, and there's going to be some work to do on the weekends and maybe in the evenings. But again, that trade-off is there's flexibility during the day, or if I need a day off here and there, it's usually not difficult to take that. Something that Dr. A mentioned in a previous answer, though, one of the things that I think pharmacists sometimes have to struggle with a little bit is, like, whereas nurses and physicians, it's usually very easy to quantify the work they're doing, how many patients they're taking care of. Sometimes for pharmacists, it's less objective. Like you have some pharmacists maybe who dispense orders and you can count those, or you have some who enter orders and you can count those. But sometimes in the more clinical space, it can be a bit more difficult. And so there is that balance of, yes, we don't want to burn out, like Dr. Gandhi said, but sometimes there's a burden on us to make sure we are justifying the position. And so I think it's just important that a pharmacist has those, whatever that documentation system in place to make sure that they can show that they are valuable and that they are, helping accomplish the mission of the organization.
Those are some awesome responses. So going into another question, kind of staying on topic of what you've explored in your career, what are some of the most interesting cases or questions you've been asked in your career or have been presented to you?
That's a tough one. So I would say, as a community pharmacist, we are often the first point of contact patients usually have with the healthcare system. 90% of the US population lives within 5 miles of a community pharmacy. And you don't have to make an appointment with your community pharmacist, you just walk in, right? And we give you advice for free, right? We're not lawyers, we don't charge you for the advice, so we give you advice for free. And so a lot of times, as a community pharmacist, what happens is, as soon as a patient sees something on TV, whether it be Dr. Oz, whether it be the news, whatever it is, they come in right away. Hey, have you heard about this? Tell me more about this. So just trying to keep up with the latest and breaking news about what is going on, and trying to anticipate what your patients are going to see on TV or read on the internet, can be challenging at times. And so just trying to keep up with that. A lot of times, when turmeric was a big thing, tell me about turmeric. Does it work? Does it help with this? Does it help with that? And now with the COVID vaccines, so how exactly does the COVID vaccine work, and what side effects can I expect? And, should I take it? What if I got another vaccine, and what happens with this? So just really trying to keep up on the latest and breaking news, can be a little challenging at times as a community pharmacist, because your patients are going to come to you right away and ask you those questions. So it's exciting, though. You hear some crazy stuff, that's for sure, but it definitely is exciting.
I think I have to agree with Dr. A. Being in the community setting, you get a host of very, very interesting questions, and such. But I think it's really fun and interesting, because as a pharmacist, you're constantly learning yourself as well. In school, when you're learning, it's like the didactics and the root of what pharmacy is. But then when you're in practice, you're always learning about, there's just so many different things that you can learn about. And I think your patients, really bring interesting topics your way that you would have never even thought about. So I think that is really interesting how, the tables have turned and the patients really help you learn about new things. But I remember I was having a conversation with a patient in terms of like, testosterone. I mean, I was on the internet with her. We were reading articles and stuff like that, like during one of my community shifts. So I think that was really interesting. But I think that, when you graduate from pharmacy school, it doesn't matter which avenue you go down. You're always like an inherent educator. So I think the ability to have that in any setting is really interesting as well, because you're always able to educate your patients, your students, and such. So I think you get to learn a lot from them as well as they learn from you. So I think that's always like an interesting experience.
I really enjoyed one of the things that Dr. Gandhi just shared. Pharmacists consistently rank among the most trusted professions. When they ask, who do you trust? Lawyers, maybe not so much, but pharmacists usually rank pretty high. And no offense to any lawyers or aspiring pre-law students out there, but and so that's a burden, a responsibility that I take very seriously. And so, yeah, I, like Dr. A and Dr. Gandhi shared, I've definitely gotten my share of questions. And honestly, with the availability and ease of access of information, patients come, with, hey, I've been doing some research and I don't think I should be taking this. I think I should be taking this instead. And that gives us an opportunity to, well, let's take a look at what you found, or let's compare it to what I know or what I found, and let's try to, help you make an informed, a lot of times maybe they want to go to their doctor, but they want some information first. So that's, again, that's a responsibility that I think we as pharmacists have to make sure that we're giving them good information. One of the other questions lately that I've been helping my physicians wrestle with, and even some patients, is, I think when patients go to the pharmacy to pick up their prescription and their copay is $10, they think that medication is $10. Well, we know that medication, it might be $10, but if you're talking about something like insulin, it's really, that actual monthly cost is much higher. It can be hundreds of dollars. And so, sometimes the recommendations that we make and the information we're trying to provide is trying to help the prescribers and also the patients understand that, hey, we really, if you don't want your healthcare costs to keep going up, we really need to make some different decisions here and really make sure that that's the right medication for you. And I'm finding that to be something that it doesn't come across very easily. And so I'm always looking for better ways to try to help patients and sometimes prescribers understand that.
That's really great to hear how you guys are able to interact with patients, especially in kind of, teaching and understanding about different things that you all are experiencing, talking about in healthcare. So kind of launching off of that, we touched earlier how pharmacists have had a large role in vaccine distribution and kind of communicating to people about COVID. How has COVID impacted your profession? Are you still meeting in person with a lot of your patients, or kind of the people that you interact with? How has your life changed with COVID?
I think, and I will always cherish this opportunity that I've been given to, be part of this initiative and immunize primarily the long-term care facility residents. To be quite honest, and I will never want, it's a very tough situation to be in, and I don't know that I can say I truly understand what so and so is going through, because during this time it's really hard to relate to people. But I have been one of the very fortunate ones, that have had family members, that have not been affected by COVID, that just have not been affected the way everyone else has been affected. So, I consider myself very fortunate. And I think that was one of the reasons that really really drew me to participate in this like initiative, just because I wanted to be able to give back to the community, give back to, the people that are struggling with it. So it really forced me to take on a new role. Um, but luckily enough, it hasn't impacted me. It actually allowed me to take on a new role, really, you know, I guess figure out what I was passionate about in pharmacy. So, so to speak, it's actually been quite a good thing for me.
Yeah, so I would say, so I have many different roles at Neomed. And so on the academia side of things, it's been impacted obviously because everything has been virtual, right? So trying to still engage students in a virtual platform can be challenging. Everyone is zoomed out, right? Everyone's over Zoom. I'm with you on that too. But still trying to motivate the students, right? Trying to be that cheerleader and get them energized and engaged about their career has been a little challenging, but it's also been exciting at the same time. On the pharmacist side of things, though, since I still work as a community pharmacist, it's just been challenging to kind of stay up to date on all of the laws that are changing every day. Like literally every day, each state obviously has their own laws, and then you have the federal government that passes laws as well. So just staying up to date on what my pharmacy technicians cannot do. So now pharmacy technicians, at least in Ohio, can start immunizing patients, whereas they couldn't before. And staying up to date on what I can and cannot do. Staying up to date on the vaccines that are rolling out. What type of storage does each vaccine need? Now we're renting one of those ultra cold freezers in case we get the Pfizer vaccine, which just yesterday, Pfizer came out and said, our vaccine is stable for 2 weeks in a regular freezer, right? So now it's like, well, do we need that vaccine? So it's just staying up to date on the changing news every single day during the COVID pandemic has been quite a challenge. But at the same time, I know that my role as a community pharmacist is really protecting my patients, right? So that's my ultimate goal, is to make sure that my patients are safe and healthy. And, I'll do whatever I have to do to make sure that my patients can get the vaccines, to make sure that they're safe and healthy. So, yeah, and one thing that I want to touch on that I forgot on the last segment was, a lot of times I'll talk to college students or high school students and they'll say, I want a career that, has more interaction with patients. Pharmacists don't really interact with their patients. I'll tell you, as a community pharmacist, I see my patients multiple times per week, all right? Multiple times per month. They're always coming in. So I really get to know them on a personal level, and I get to know their family on a personal level. So, for students to think that pharmacists don't really interact with their patients that much isn't really true. Community pharmacists, I would say, see their patients much more than any other healthcare professional sees their patients. So I just wanted to throw that in there as well.
Yeah, I echo, what Dr. A said on the academia side. At Drake, we obviously shifted to online to try to finish up, schooling for the spring semester of last year, and yeah, we're some of our classes are back to meeting in person, and some are a hybrid, and I'd say, yeah, everybody's hitting their Zoom threshold, but we're doing our best, and we're trying to find that balance, like everybody is, on how do we stay safe, how do we keep our students safe, how do we keep our faculty safe, but yet how do we get some of those education things really are better in person, and so we're trying to find that balance, like everybody is. At my clinic in West Des Moines, we were one of the few local sites in the Des Moines area that did not close to students. A lot of the hospitals just said no students, no pharmacy students, no medical students, no nursing students. And my site was one of the few that didn't put that restriction in. And because mine is a data-driven rotation, my service really was not impacted. And so in fact, I actually, over the last summer, normally I'd have 2 students per rotation. They temporarily suspended some rules, and I actually had 3 students per rotation, and I just found different places for them to spread out and work on the data. So, for those who are interested in data, in informatics and things like that, we're not going to let a little pandemic slow us down. No, we're, full steam ahead. We were still, doing our work. There's still plenty to do, but yeah, I 15 years ago when I was graduating from pharmacy school, I received my vaccination training, but I never used it because I went right into the hospital and whatever. Well, just a couple weeks ago, I actually went back through immunization training with a bunch of P1 and P2 students. And this week I'm going to be going back and into my first vaccine clinic. So I'm going to be right there with my students given, and that's not something I would have done except there's a need, there's just a need for trained people to give vaccines. So that's one way, a personal way that my life and career has been impacted a little bit by the pandemic.
This is a question more specific for Dr. Daly. So you say that you work in data. How does that kind of work with pharmacy? Is that more of a research kind of position or analyzing drugs? Can you go into that a little bit?
Sure. And I'm going to try not to put you guys to sleep. So I'll try to keep this, so students perhaps have heard of these ACOs or accountable care organizations. So there's been this big shift in the last probably 10-ish years from what was known as fee-for-service care to value-based care. And what's happening is employers, especially large employers, are starting to enter into contractual relationships with healthcare providers because they're trying to control the cost of care. Anybody who has paid for their own health care, their own health insurance, probably can attest that in recent years, those premiums just keep going up. Those health premiums that you're paying to take care of yourself. So anyway, my role, I get a lot of claims data. So we get both medical and pharmacy claims data. And what I am trying to do is identify opportunities to save on prescriptions. A common prescription that a lot of people are probably aware of is Lantus. It's a long-acting insulin to take, for diabetics to take to control their blood sugars. Well, recently there was a kind of a Me Too Lantus called Basaglar came out, and Basaglar is about 20 to 25% less expensive than Lantus. Now, patients may not see a difference at the pharmacy, but that ACO, meaning that contract between the provider group and the employer, they see a significant difference if we get a bunch of our patients shifted over from Lantus to Basaglar. So that's one of the ways that's just a kind of a top of mind example, but that's one of the ways that I'm using my data. So it's not so much research, it's really about how do I help the clinic that I'm working for save money and the employer groups that they work for save money. So again, I hope I didn't put you guys to sleep, but that's the quick answer.
That's very interesting. All right, we have some questions from students. So we're going to start with this one. It's for anyone to answer. What is the hardest part about your job and what drew you to go into pharmacy?
I think the most challenging part about our job as pharmacists, and I think Dr. A already had mentioned this, but it is really, at times it's tough to keep up with the ever-changing laws, ever-changing information. So, you really do have to be keep up to date on the new laws, the new drug information that has come out. So I think that's the most challenging part in any setting. So I think I'm going to just give you a universal answer. What drew me into pharmacy was just being able, my dad is a prime example of an individual who has multiple disease, our health conditions and stuff like that. And I've seen him struggle, as a kid, taking his medications and really just following through with his, management of it. And there were a lot of times where he was like, "Oh, I'm not taking this. I feel fine now." And especially in terms of antibiotics. And, when you actually start practicing, that is one of the things that you're kind of just like, oh God, like it makes you cringe just a little bit. Like, even if it's a 5-day, 7-day course, patients don't really realize that they need to finish the full 7-day course to see, um, great effects of the medication. So I think a lot of times they don't have enough time to speak with their physicians and to really learn about the medication and the therapy that they're on. And I saw that with my own dad. And there were so many times where he was like, "Oh, it's okay, fine. I don't need to take it. I feel fine." And so it was at that time, and I was like, you know what? I want to go into this profession to help people like my dad, be a little bit more adherent to their medications, to help them understand the importance of it. Why do you need to take this antibiotic for 3 days as opposed to 5 days, as opposed to 7 days? And why do you need to finish the full course of therapy, and such? So I really wanted to, be able to provide that information, that education, in a clear and concise manner. So I thought this was it was a great fit for me.
Yeah, so I would say, like earlier, the hardest part is really just kind of staying up to date on things. And sometimes as a community pharmacist, you're the middle person, right? You're the messenger, and sometimes patients can take out their frustration on you, right? When they're paying $500 or whatever it is, whatever their copay is, or their medication isn't covered, and you have to try to explain to the patient, well, look, it's not me. I would love to give you this medication, but your insurance won't pay for it, right? So just trying to explain that to patients, and being that person that they take out their frustration on can be a little taxing sometimes. But what I found more often than not is patients usually come back, they'll call, or they'll come back and they'll apologize. They were just angry in the moment and they didn't mean to take it out on you. But just sometimes, being that middle person can be a little challenging. What drew me into pharmacy, and I'll be honest, I had no idea what pharmacists did until my first year of college. I knew something with medication. I knew they gave out medication to people. They probably counseled them on their medications. That's about it. I had no idea. So my freshman year of college, I knew I wanted to do something in healthcare. I just wasn't sure what it was. So I joined every pre-professional club there was, right? Pre-optometry, pre-dentistry, pre-med, pre-this, pre-that. I joined every pre-professional club that there was. And at the same time, I learned that you could become a pharmacy technician once you're 18 and you have a high school diploma. And I'm like, okay, let me go get a job as a pharmacy technician and see if that works for me. So I got a job as a tech at Rite Aid, and I loved it. I saw the impact that the pharmacist that I was working with, the impact that she had on her patients, the relationships that she built with her patients, that they trusted her more than anyone else. And I wanted to be that person, right? I'm the type of person where I love building relationships with people. I love meeting new people. I love talking to people. And so I was like, I want to be that person. I want to have that kind of impact on my patients' lives where they know that they could come to me with any question, that they could trust me with these medications that affect their lives completely, right? That are saving their lives, that may harm them. So for the fact that the patient can come to me and trust me with all of that, I want to be that person. And so, once I got a job as a tech, I realized this is it. This is for me. And the other thing that I found about pharmacy is it kind of, at least community pharmacy, is it kind of encompasses a lot of the other healthcare tracks that I was interested in, right? So I get prescriptions from dentists. I get prescriptions from pediatricians, from optometrists. So I have to be somewhat familiar with all of those areas because it's not like, I'm so narrowed and focused on one area of medicine. I see prescriptions and medications for a whole bunch of different areas. 80% of disease states are managed by medications, right? So I need to be familiar with all of those disease states and what the medications do for those disease states. So that's the thing that I really like about it, is that it encompasses everything that I kind of was thinking of doing to begin with.
I did not want, so my wife is a nurse, and I knew I didn't want to be that close to patients. I didn't want the blood, and I didn't want the whatever, but I love math and I love science. And I can tell I'm a little bit older than my fellow panelists here, and I graduated in 2005. And back then in the mid 2000s, the job market was very different. They were desperate to fill pharmacy positions. And, I'm going to be honest, it looked like, a fairly attractive, stable way to make a living. And now, the market is different. And I believe it's a little, jobs are not as easy to come by, or you're not guaranteed maybe to find the exact role that you want, or maybe in the place that you want to, whatever. But I also think that these things are cyclical, and I think give it a few years and, the market's probably going to change again. But, so to answer the question about the hardest part of the job, I agree with Dr. A. Sometimes pharmacists are stuck in the middle, and sometimes we have to be the quote unquote bad guy, the bad person. We've got to tell the patient, well, this is going to cost X, or maybe sometimes we have to work with the provider, the prescriber to fix. I'm actually seeing another question about how do you handle situations where the physician may not have prescribed the right dosage. We have to, we are sometimes, the pharmacist can be the last line of defense, and we've got to make sure that prescription is written correctly, that the dose is right, that the frequency is correct, that it's the right dosage form. And that can involve sometimes some tough conversations. If the physician who prescribed it is no longer there, they're not answering their phone, and the patient's standing there and they're waiting. Yeah, those can be challenging situations, and it requires skill, it requires good communication, it requires diligent follow-up. And I think that's one of the things that pharmacists, my sense is most people who go into pharmacy tend to be detail oriented. Sometimes people call us perfectionists. We like things to be perfect. We want it to be right. And that's one of the things, again, that makes us a trustworthy profession.
Those are great responses. So we touched on the second question that we had asked in our Q&A, which was, how do you handle situations where the primary physician may not have prescribed the right dosage or drug? Does that happen? Dr. Daly already touched on this. If anyone else would like to touch on it, feel welcome to go ahead, or we can go on to another question.
So absolutely, all the time. It happens all the time in a community setting. And at that point, it's your expertise that will allow you to, I guess, determine that the dosage isn't right. And sometimes you just have a gut feeling. You're like looking at this prescription, like, this just doesn't look right. So what I've been doing to help me in the community setting, and I still actually have this, is I have pharmacy apps, drug apps. One particular one I use is Medscape. And I really like this app because it breaks down every drug. And it breaks it down into like dosage and indication, what the right dosages are, your pharmacokinetics, pharmacology, side effects, adverse side effect or warnings, pregnancy. So sometimes I cherish that. So I've used that when I've had gut feelings. I'm like, oh, I don't really know if this is right. Or maybe, sometimes when you're just like going through so many prescriptions, sometimes you're like, maybe not. So I usually reference that. And, once I do forget, I was like, oh, okay, like this isn't the right dose, or it's not the right frequency, or it doesn't even come in this dosage form anymore. At that point, honestly, the best thing to do is call the physician's office right away. If you can't reach the physician, try to get to their nurse, because they still have access to those patient records. And they, by law, still have the right to change a prescription. They can change the medication or whatnot. So, just be super proactive about it. And like Dr. Daly said, sometimes in a perfect world, you'll be able to reach a physician, they'll change it, you're good to go. In a not so perfect world, you may not be able to reach the doctor. You may not be able to reach the nurse. Even if you do reach them, sometimes they're like, oh yes, sorry, I did make that mistake. That was not the right dosage form, or that was not right. That wasn't the right strength. Then at that point, it's like, okay, well, now they change it, but do you have the strength in stock? So it's a lot of going back and forth. But the best approach to it is just to be very proactive about it. Suggest, okay, so we don't have this strength. And such. So here's another medication in that same class. Could we just substitute it for that? You know what I mean? So it's just like being really on top of your game and figuring out like what substitutions you can readily recommend, just so you can provide the best health outcomes to your patients, really. So that's what I do, and I swear by my app. It comes in handy.
Yeah, so just kind of going off of that, I agree. We practice what's called evidence-based medicine, right? So we have evidence to back up all of the recommendations that we make. It's not a blind recommendation, right? There's, facts and studies, randomized control studies that go into our recommendations. So it's not like a random sort of thing. For example, you all recall the hydroxychloroquine fiasco last year, right? Hydroxychloroquine for everyone. Oh, come around July. Oh, wait, nope, doesn't work. So when the first announcement came out in April, hydroxychloroquine, we were seeing tons of prescriptions for hydroxychloroquine. We're like, whoa, hold on. There's no evidence to back this up. Just because someone on TV said it doesn't mean it works, right? So we like to go off of evidence-based medicine. And so, in the community setting, it's kind of one of those things where you kind of have to build certain relationships with the physicians for them to kind of trust you and be like, okay, yeah, this pharmacist, they know what they're talking about, which can be hard because they don't actually see you in person. They interact with you, very minimally. In the hospital setting, it's different, right? So if you're a pharmacist in the hospital, a clinical pharmacist, you work with the same physicians over and over and over again. And so, those pharmacists in the hospital, they build those relationships with the physicians. The physicians end up, really trusting them. One thing that a preceptor once told me in my 4th year of pharmacy school was, whenever you're making a recommendation to a prescriber, a good way to start it would be with saying, as you know, because it's kind of like one of those compliments. Like, I'm giving you a compliment. I'm assuming you already know this or hoping that you already know this. So I'm just going to say, as you already know, such and such. So, just kind of being strategic in the way that you approach it, right? Not this is completely wrong. You don't know what you're doing. This isn't correct. You need to do it this way. Well, that's not going to get you anywhere, right? So you kind of have to, be diplomatic about it and be professional about it.
Those are some awesome responses. So we have only 2 minutes left of this panel, which I feel is unfortunate because we've had some great discussion here today. So as we kind of get ready to exit out, do you have any advice for current undergraduates interested in pursuing pharmacy that you feel you wish you had known or that you just feel is important?
Yeah, so just do your research on it, right? I think pharmacy is a wonderful profession. Obviously, I wouldn't be here if I didn't think it was. So I think it's a great profession to pursue. And, obviously you want to do your research as to if you're thinking about applying to a college of pharmacy, do your research on those colleges, right? See how successful they are, right? What are their NAPLEX pathway? NAPLEX is the exam they have to take to become a licensed pharmacist. So how successful are their students? What's their job placement rate? What's their residency match rate? How successful are their students? Look, pharmacy school is going to be expensive anywhere you go. It's a professional program. That's just how it goes. It's going to be expensive. So really it's just kind of looking at how successful are the students that have graduated from that institution and go with that, because that tells you a lot.
My advice would be, and I think a lot of the students are already doing this, but participate more in panels like this, really get to speak to your pharmacist. And also what I would say is just, the best way to learn about something and the best way to figure out what you're passionate about is to actually put yourself in that setting. So if it's a possibility, work as a pharmacy technician, see what you like about the community setting. If there's any volunteer opportunities, do that. Do a lot of community outreach, volunteer, just put yourself in that setting, because even from that alone, you will learn a lot about what you as an individual like about pharmacy. Everyone is very different. So that really kind of helps you narrow, why you want to go to pharmacy. What do you want to do upon graduation? What do you want to do while you're in school? What professional organizations do you want to be part of? So along with the research, really just put yourself out there and, build a network from the get-go, because as you will slowly start to learn, pharmacy is a very close-knit community. It is a very small world, and you really benefit from networking with individuals. So start early on, and you never know, you may one day be working with a pharmacist that you started your community outreach with. So it's a really good, I think, circle that happens after a while. So I would say really just put yourself out there and get as much experience as you can from the beginning.
I think Dr. Gandhi and Dr. A nailed it, and I have nothing new to add.
That's wonderful. Thank you so much for coming to our panel. I have sent the link to the PreHealth kind of home-based website. So if you're attending any sessions after this, please reference the link to find your Zoom link. Again, a big thank you to our panelists for participating today and taking some of their time to help Iowa State students on their journeys. Yes, thank you.
Thanks for having us.
Thanks very much.
Yep. Thank you for having us.